Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We are your hosts, Dr. Jamie Irwin, board-certified OBGYN,
and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counselor education and supervision. Jamie and I have been friends for over 30 years.
Each week, we explore the intersection of body, mind, and soul, bringing you evidence-based medicine, meaningful conversations about mental health, and stories that remind us we're not alone on the journey.
So take a deep breath, settle in, and let's begin the journey. Have you ever woken up at 2:47 a.m., me this morning, wide awake, heart racing, wondering if it's anxiety, hormones, cortisol, blood sugar, or just your brain betraying you? Today, we're going to explain what is actually happening in the body during sleep and why sleep may be one of the most powerful health tools women are underusing. Yay, I definitely need this, like literally this morning. Woke up needing it.
Sleep is huge.
It's huge. And why is it so hard? And what made it so hard?
We're going to talk about it, why it's so hard, but it is hard, trust me. And as an OBGYN of 17 years, having to do 24-hour shifts, not as much as I used to have to do, thanks to my amazing call group, and shout out to all my partners, but sleep is huge.
It's so important.
It affects us in major ways. There's major potential health complications if we're not getting enough sleep. And let me just start with the fact that I am not a sleep medicine doctor.
Right. Me neither.
You're not either. That's a whole medical specialty. I am an OBGYN. I am a 45-year-old woman, and I need my sleep.
Yes.
Mama's got to sleep.
Me too. I'm a therapist, and I also need my sleep.
We do.
We need to be able to function.
Every woman does. So adults generally need 7 or more hours a night.
Okay.
But of course, everybody is a little different. And depending on the day you had and what you're asking of your body, you might need more.
Yes.
And there's definitely days that you are going to get less. But the CDC links insufficient sleep with higher risk of obesity, diabetes, high blood pressure, heart disease, stroke, anxiety, depression, accidents, medical errors.
Sure.
Hello.
You're not thinking straight.
No.
Yeah.
How can you? How can you? But, you know, sleep, it's not just a pause button. It's when your body does some of its most important work.
Yes. I heard a sleep psychologist one time at a training, and she was talking about, we think sleep is our brain resting, but it's not. Our brain's actually working really hard while we're asleep. It's filing everything. It's processing all the things from our day. It's processing our emotions, why we have some crazy dreams is what she said. I just thought that was so fascinating.
Mm-hmm. It's true. There's so many benefits of good sleep, including better insulin sensitivity, better appetite regulation, better mood regulation. That is so true. If I am post-call, I am not my best self.
No.
And I just have to remember that. Like, the mood is not ideal.
Sometimes you just need a nap. I notice that when I'm crabby, I think, okay, maybe I just need to go take a nap if it's possible. It's not always possible,
Not
though.
always possible. Other benefits include improved memory, learning, focus, and reaction time. Have you seen this game show, by the way? I don't even know what it's called, but my kids found it, and it's a reality thing.
Okay.
They keep these people up for 24 hours straight.
Gosh.
And like phase 1 is they're up for 24 hours and they're counting coins all night long. And so the person who has like the highest number and it's the most accurate to what the actual total is gets to go on to the next round. And my kids were like, Mom, you'd be great at this. I was like, maybe not. I don't know. Also, stronger immune function is a benefit, better pain tolerance.
Really?
Yeah. And better hormone regulation, which, as you and I know, in midlife,
Yes.
we need all the help regulating
So
these
important.
hormones.
We do.
So sleep is really important for that.
Yeah. So with sleep cycles, what is actually happening?
So sleep cycles include, we have non-REM and we have REM. And so REM stands for rapid eye movement. But you cycle through these non-REM and REM every 80 to 100 minutes. And there's usually 4 to 6 of these cycles every night.
Okay.
So the non-REM is the lighter sleep and deep slow wave sleep.
Okay.
Whereas the REM is important for dreaming, for memory, and for emotional processing. So,
which is interesting with like what we talked about last time with trauma. That's when people are having their flashbacks or having, the weird dreams.
Isn't that interesting?
Because it's affecting that.
So the non-REM has 3 stages itself, including drifting off, then followed by light, stable sleep, which makes up the large portion of the night. And then the third part of non-REM is the deep sleep, the physical restoration, the immune and metabolic repair. And then the REM is, like I said, the dreaming, the emotional processing, and the memories.
Okay.
So you don't just go unconscious for 8 hours. It's not like you just, flip the switch and you're out. You cycle through these different biological jobs. Your brain is working and doing these jobs all night long.
Wow.
Yeah, it's really fascinating.
It is. It's fascinating. Back to the inside out we mentioned last time, but like I picture isn't it like the little blob people walking around and they're pulling stuff out? Like, should we keep this? Should we forget this? Should we play this memory for her in her sleep? Yes.
Such a clever movie.
Yes.
You've got it. Everybody needs to watch that. That is so true. Yeah. So there you have it. Now, do you have a wearable? Do you sleep?
I do. I've got my Oura ring.
You've got the Oura ring. What do you think about it?
I tried wearing watches. I just couldn't sleep with the watch. It just would wake me up because it was moving my eye. I think though it's nice. Obviously we're not sponsored by anything.
No.
But it's interesting to see. I can see these cycles on and you can tag different things. Like if you ate sweets later in the day or how much exercise you got or the stress, it tracks your stress so it can see. It can show you how it's trending, how it's affecting your sleep, which is really just interesting to me.
Same. I like to nerd out. I like to look at it. My husband was the same way. I got him a wearable, a Garmin watch, but it bothered him. He didn't like to sleep with a watch. But then it was also stressing him out, all these metrics.
Yes.
Right? Because so he'd get in bed and be like, he'd be thinking about it. Like, is this good sleep? Is it good quality? And like, it was actually counterproductive.
Yes.
And really negatively affected his sleep because he was
making him
focused
stressed
on it.
Yeah.
Yeah. So turns
so
out
that is not a good effect.
Yeah.
Don't wear it.
It's not worth it if that's going to happen. But so wearables, they're okay. And so when I looked at the data on this, the take-home point with wearables, whether it's the ring or a watch, think of it as a dashboard, but not a diagnosis.
Gotcha.
So it's really more accurate at just estimating were you asleep or awake. So even though, my Garmin does tell me like this is when you were in REM and this is deep and what have you, it's not super accurate at staging the light, the deep, and the REM sleep. What is accurate is a sleep study. So we're going to talk more about what that is. How do you know if you need one? But a sleep study, also known, the fancy word, the doctor word, is polysomnography.
Okay.
And that really is a diagnostic tool and is the gold standard because it measures brain activity, eye movements, muscle tone, breathing, oxygen, and there's audio and video sometimes if you go get a sleep study. But more on sleep studies to come. So, don't ditch your wearable if you like it. And if it's not stressing you out like it did Charlie,
keeping you awake,
then it's fine. It's going to give you some data.
Yeah.
So there you have it.
For me, sometimes it's helpful because I'll feel like I was awake most of the night. And then I look and see, okay, no, I got some sleep. I'm okay.
Yeah.
And I think that's been helpful for me too. Because
like,
when you do wake up in the middle of the night, you're like, it feels like forever.
Yeah. Yeah. Same. When I'm on call, it can be like, oh my gosh, I got no sleep. And then I'll look and be like, oh, actually I did. I got some sleep in between phone calls or in between deliveries. So, it can give you that little boost to like, you can do it.
You can do this. You got this.
So what have you noticed that disrupts your sleep, Mary Catherine?
Definitely caffeine late in the day. Can't do that anymore.
So what's late for you? When do you try to cut off caffeine?
Really, I just have it in the morning. I have coffee in the morning and that's typically it. Maybe at lunch I'll have some tea, but after that, typically I'm done with the caffeine.
Yeah, good.
What about you?
Yeah, so good idea to cut off the caffeine. I would say like 1 or 2 p.m. I made such a mistake a couple of weeks ago. I waited to run till the evening. It just was a day. I'd been up late the night before, like the morning run was not going to happen. And so I ran after I got home, and it was a long run. So I took one of those goo gels.
Oh, yes.
And then literally after I just finished, I was like, it had caffeine in it.
Oh,
they don't all have caffeine, but that one did. I'm like, I am going to be so screwed tonight. And I was. Yeah. So, and that was kind of the double whammy. It was a very hard workout late in the day and caffeine, and it was not a good setup. But other disruptors, alcohol.
Yes. I really can't do alcohol anymore. I really can't. I mean, unless it's just worth it and I know I'm going to not sleep well tonight.
You have to choose.
Yeah.
Do I want to drink or do I want to sleep? That's where I'm at too.
Yeah.
So definitely alcohol, it can help with sleep onset. It can make you drowsy. It can make you sleepy, but then really fragments your sleep later in the night. Bright screens.
Yes.
Oh gosh. We're all so guilty of this.
Yes.
You know, what do we do right before bed? I'm on my phone.
Yeah.
Check in whatever, check in my email, check in social media, check in my patients at the hospital, whatever that may be. But turns out that bright light, that backlight, the blue light specifically, tells our brain to wake up.
Yeah.
Stress, rumination.
Yes, that's a big one.
Huge. You know, and then things like pain, right?
Yes.
Backache, pain, joint pain, having to get up to go to the bathroom. Reflux, heartburn, that can be a big one, especially for our pregnant patients. Some medications can really disrupt your sleep. Restless legs. Have you ever had this?
Yes. Joseph will tell you for sure.
Did you have it in pregnancy or you have it outside of pregnancy?
Like now, sometimes I will kick him. Yes.
Yeah. It's terrible. Restless legs. Sleep apnea is where you actually stop breathing during the night.
That's scary.
Yep. Depression, anxiety, and then, of course, hormone changes. Yes. Hot flashes and night sweats.
Night sweats, yes.
That definitely can disrupt our sleep.
Listen to the perimenopause one if you're wondering about that.
Episode 5. I think a lot of women, like you alluded to, though, in the intro, this kind of 2 a.m., 3 a.m. wake up. That really seems to be pretty common across the board, but I think especially for those in our age group.
Yes,
so
I think so too.
Tell me more about your experience with that.
I've definitely noticed a connection with the cortisol, with the stress. So for me, if it's been a more stressful day, or if I have something, even good stress, you know, for the next day, I notice it stronger more often. That I'll have those sorts of wake ups. And then because there's something, my mind starts going and I start thinking about it. Yeah. So I've recognized that I really have to have a cutoff before bed. I really try to cut off like after dinner, where I don't think about work stuff. I don't do emails. I really do notice a difference, and try to have more of a wind down time where I'm kind of disconnecting, even if it's just watching a show that's just fun and thoughtless, or going for a walk, not a hard workout, but just doing some things that help me to decompress, disconnect.
Yeah, to calm your brain down, calm your nervous system. So here's the science behind the 2 to 3 a.m. wake up and why it's happening. So it can really be a combination of cortisol, glucose, anxiety, and your hormones.
Okay.
And it might be all of it.
All the things, probably.
It really could be all of it. So sleep becomes lighter in the second half of the night. So that's really the first thing that's happening. If you're wondering, like, well, why is it always 2 or 3 a.m.? Why is it not earlier or whatever? Or even later? Like if I woke up at 5 on my own, like fine, I'll just get up and be productive. But the 2 to 3 a.m. is just such a wrecker. But sleep becomes lighter the second half of the night. And the REM, this rapid eye movement period, becomes longer toward morning. So, you know, I find it interesting because I feel like I am dreaming right before I wake up. And there's science behind that. That's that rapid eye movement. In addition, as you get closer to wake up time, your cortisol does begin rising. So that is our stress hormone. And so the cortisol is actually going to surge in the first 30 to 45 minutes after you wake up. But, you know, especially in midlife, as other hormones are fluctuating, cortisol can start to peak early at this 2 a.m. When the sleep is already, you're in a lighter cycle. And throw in a hot flash, throw in, a dip in your estrogen and progesterone, you're hot flashing, you're uncomfortable, that is going to wake you up. Throw in some anxiety in there too with racing thoughts. Once you wake up, your brain is churning and then you're not going to go back to sleep.
Right.
So it really is multifactorial. I mentioned that late workout with the caffeine, of course, but I think my problem was, and why I woke up that morning around 2:30 was it was such an intense workout, and then I didn't eat enough, and I really felt like my blood sugar dropped as well. And so
that makes sense.
Your body's like, hey, wake up, your blood sugar's low.
I need to eat.
Yeah, again, trying to protect you. So, the 3 a.m. wake up, it's rarely one thing. It's lighter sleep plus a reactive nervous system plus whatever your body is dealing with, the stress, the hormones, the alcohol, the cocktail you had, the glucose swings, the temperature dysregulation, or it could be, something like sleep apnea or the restless legs or some other medical condition. It's tough. So we need help.
We do. Help us.
We need help. So let's talk about some useful things. There's something called sleep hygiene.
Yes.
Sounds weird, right? Like, what do you think when you hear that? Sleep hygiene.
Cleanliness of my sleep.
Yeah, like your hygiene is like, practice good hygiene, take a bath, wear your deodorant. Those are things I'm telling my son. So sleep hygiene we're going to get into, but what truly helps with sleep disorders, insomnia, middle of the night wakings, is something called CBT-I. We've talked about CBT. So cognitive behavioral therapy for insomnia. And so this is what the American College of Physicians recommends as the initial treatment for adults with chronic insomnia. Do you have experience with this, CBT-I?
I don't. I'm not trained in it, but I have read about it, and it sounds really interesting. The principles are really interesting too. But just recognizing how our thoughts affect it, recognizing, cognitive behavioral therapy is focusing on our thoughts and just recognizing when you wake up, I'm okay. I'm going to get some sleep. It's not, because oftentimes what we do is we look at the clock and we freak out and it's been this long and I'm never going to sleep. And oh my gosh, I have this thing today. And our mind just goes. So instead working on those, but I'm not trained in it, but I know there are professionals who are in it, and I've referred before. So I think it's great. That's awesome. It'd be really helpful for people.
Yeah. I've been guilty of that spiral. And then you start the calculation.
I think we all are,
right? Have you done that? Where you're like,
for sure.
Okay, well, I go to sleep right now. Then I can get 4 more hours. And then that could be okay because I think I got 3 hours, or I think I got 2. And then maybe I could take a nap later. And then,
yes, you start just trying to piece it all together.
It's bad math in the middle of the night for sure. So CBT-I, look into that. You can search up a therapist who has special training in this.
Yes. And your probably your provider has people they refer to too.
Awesome.
Yeah.
Awesome. But as far as sleep hygiene goes, here are some practical tips. So the same wake up time every day.
Okay.
Yeah. I don't want to do that though.
I know.
On weekends it's like I want to sleep in.
It's hard. And sometimes as a parent, I can't talk. It's hard, because something's happening, or when your kids are little, they wake you up unexpectedly, or the dog comes running into the room. There's some things we can control. There's some things we cannot.
Yeah. So doing the best you can. And along with that, trying to have a bedtime, right? So keeping the bedtime consistent. So going to bed the same time, waking up the same time. Another thing that's really helpful is getting morning sunlight.
Interesting.
Yes. So that really helps support our circadian rhythm, which is that part, it's set by a part of our brain. And, similar to how the phone light wakes us up at nighttime, we need to avoid it. That sunlight in the morning, it said, oh, we're awake.
We're awake.
It's time to be awake. So it really can help you get better sleep at night by getting morning sunlight.
Okay.
So just going outside, even like taking your cup of coffee and just stepping outside can be helpful. We've talked about cutting off caffeine. We've talked about reducing alcohol, both really good practical tips. A cool room. Yes. What do you like your temperature at?
I like it pretty chilly. I like to have a blanket on and not be hot. So
yeah. So
what about you?
Oh, same. Like, much cooler than my partner.
Yes.
For sure.
Yes.
For sure. Charlie thinks like normal room temp is like 74, 75. I'm like,
right.
Where?
Yeah.
Not in this house, sir. No, sir. But what I did is I invested in a chili pad.
Oh, I've not heard of this. Chili
change,
pad.
Yes. It can change your life.
Okay, tell me.
Okay. So I got just the twin size because it's for me, not for him.
Yes.
Yeah. And it's, remember when you had your ACL surgery? Did you have the little cooler?
Yeah, I borrowed yours.
It was mine.
Yes.
Yeah, perfect. That's right.
Yeah.
So there's a little cooler next to my bed. Yep, a little cube cooler that you put distilled water in, and then there's a hose, and then this thing is a mattress pad cover that circulates, and you have a control over what temperature you want to set it at.
Wow. This is amazing.
Life-changing.
Again, not sponsored, but amazing.
Yeah. It's so great.
Chili pad.
So that's my chili pad. I got it on Amazon. To me, it's worth it. I've had it for years.
Yeah.
You just, have to kind of keep it full of the distilled water.
I've got the cold fan blowing on me. And I've got, but that sounds amazing.
Yeah. So that helps. And it, cost savings if you don't want to crank down the temperature of your whole house. Yeah. A dark room is another piece of sleep hygiene.
I sleep with the eye mask on.
Same.
I've got to, I can't handle the light. If we're at a hotel, I have to cover up the random little light things.
Yeah. So the dark out, blackout curtains, really good idea. Keeping the bed for sleep or sex only. Have you heard this?
Yeah.
Yeah. So trying not to...
It's like the cognitive training for your brain.
Exactly. Yeah. Exactly. So, not bringing your work and your laptop into the bed. And I mean, I do that sometimes, right?
I think we all do.
I think we all do. But if it's a problem, right, then if you wait... And another piece of this is that if you do wake up, to not just lay there awake.
Right.
Like get out of bed and go somewhere else.
Yes.
Until you are sleepy. Read something that's going to put you to sleep and then go back to bed when you are sleepy. No clock watching.
Yes.
A wind down routine. You mentioned that. So that could be a warm bath. That could be some aromatherapy. I've got like this vagus nerve oil. Who knows if that works, but it smells good. I kind of put it back here on my neck, and I think there's something to aromatherapy, right?
Yeah.
And then avoiding those intense workouts right before bed.
Yeah. I think of it as almost like when we have babies and you have like a whole bedtime routine. Like you take the bath, give them a bath, read them the books. Like we need that for us too. We need something that tells our body, hey, I'm preparing to go to bed. These are the steps that I'm doing. This is my wind down routine. Because it's important.
Yeah. There's a lot of good sleep meditations out there.
Yes.
It goes back to, we've talked previously, we have to speak body language to our body.
Yes.
And so sleep hygiene, it really comes down to that. So sleep hygiene is a foundation, but again, the CBT-I, the cognitive behavioral therapy for insomnia, is the treatment with the strongest evidence for chronic insomnia. Yeah. So, of course, there are medications out there.
Of course, yes.
So I do want to touch on those. Of course, always consult with your healthcare provider before you start taking anything to help you sleep. But there are medications out there that exist, sleep aids. Ambien or Zolpidem is the generic name. So it's a pretty well-known sleep aid. It is a prescription. It's a controlled substance. The American Academy of Sleep Medicine gives a week recommendation for select use in sleep onset and sleep maintenance insomnia. And there is an FDA box warning for complex sleep behaviors. So you may So this means sleepwalking, sleep driving.
Oh gosh.
I've heard of sleep shopping. So people taking this and then having these, sleep behaviors where they have zero recollection of purchasing things online or walking. I mean, how scary would it be to be driving, but you're actually asleep?
That is very scary.
So, to be used with caution, there definitely is that FDA box warning. They can work short term, but they're not risk-free, and definitely avoid Ambien with alcohol, other sedatives, or if you don't have enough of a sleep window. So you wouldn't want to take an Ambien when you can only lay down and sleep for like 3 or 4 hours.
Right.
Because it's going to last longer than that and you're not going to be awake. Next, we've got things like Unisom, which is doxylamine, and Benadryl. These are in a class called anticholinergic. So the generic for Benadryl is diphenhydramine. So these are over the counter. The American Academy of Sleep Medicine suggests that clinicians not use Benadryl for sleep onset or sleep maintenance insomnia. So these really aren't great options.
Right.
There's some newer evidence that is concerning for prolonged use. So if you were to take a Benadryl every single night of your life, potential increased risk of dementia.
Oh, goodness.
So these are not something that we need to be using long term. Now, pregnancy insomnia. This is a hard one.
Yes,
this is a hard one. And as with most medications in pregnancy, we don't have good studies.
Right.
So in pregnant populations, again, that's going to be a short term. You're not going to be pregnant forever. We're talking more about years and years and years of usage of Benadryl or Unisom. But in short duration, I will recommend to my patients that it is okay to take one of these anticholinergic medications to help them sleep.
Sure.
Because you got to sleep.
Sure.
Right? So, sleep is one of those first dominoes that when it goes, everything else can go down with it.
Yeah.
So that's just a few. There's also a medication called trazodone. Again, the Academy of Sleep Medicine suggests that clinicians not use trazodone for chronic sleep onset or sleep maintenance because the benefit is limited relative to the harms. Side effects can be morning grogginess, dizziness, orthostasis, which means kind of a change in your blood pressure. It is widely prescribed, but the evidence for primary insomnia is weaker than people think. So anyhow, definitely talk to your doctor about what may be helpful, and truly what may be the most helpful is this CBT.
Yeah, sure.
Yeah. How about we talk about a sleep study?
Okay, let's do it.
And we can kind of wrap it up here. So I mentioned what a sleep study is. Do you know anybody that's had one?
I do, but I don't think I know any women who have had one, to be honest. Yeah.
So I'm going to take a guess and think that women are not getting sleep studies like they should.
Probably.
And I don't really know why.
Yeah.
I don't know if that doctors just aren't recommending them or women aren't, maybe they don't want to talk about the fact that maybe they snore. I don't really know.
Yeah, good question.
But I think they're very widely underused in our female population. So a woman should consider a sleep study or talk to her physician about ordering a sleep study if she has loud snoring, witnessed apneas. So that's that moment where stops breathing.
Yeah,
so kind
of, yeah, gasping maybe.
And then there's no breath being taken.
Oh gosh.
And then they kind of wake themselves up, right? Gasping, choking at night would be a reason to get a sleep study.
Okay.
A morning headache. Yeah. So, headaches, tension headaches specifically, are more common at the end of the day.
Yeah.
But if you wake up with a headache, that can be concerning.
Sure.
And it might be that, poor sleep or maybe sleep apnea.
Okay.
That you're not getting good oxygenation at night while you're sleeping. If you have excessive daytime sleepiness, now that's pretty subjective.
Yeah, that is.
There's days where I feel very excessively sleepy. I don't know. Maybe I need to pay more attention and think about getting a sleep study. But high blood pressure, any kind of stroke history, heart rhythm abnormalities like atrial fibrillation or AFib, congestive heart failure. So really any significant cardiac history, a woman should have a sleep study. If a woman has obesity or a very large neck circumference, if there's worsening insomnia despite good treatment, restless legs or the periodic limb movements, that warrants a sleep study. Or if they're having what's called parasomnias. So this is the sleepwalking, the sleep eating, acting out dreams. And this is, of course, without taking something like Ambien. So if you're just doing that, severe fatigue despite getting, quote, enough sleep.
Okay.
So maybe you're getting enough, but maybe it's
Still
not
tired.
Adequate, that deep sleep, that restorative sleep.
Mm-hmm.
So the sleep study, also known as the polysomnography, is at a sleep medicine center.
Okay.
But they do have now these home sleep apnea testing for uncomplicated adults. So obviously, if you have kind of a complicated cardiac history, you need to go get in the center. They hook you up to all the machines and the monitors. But there is an option for home sleep testing, which is exciting. So, not every tired woman needs a sleep study, but snoring plus daytime sleepiness, witnessed apnea, morning headache, or resistant high blood pressure should not be ignored.
Good info. Yeah.
So I think we need to be testing more women to help them out, because sleep is so important. We've mentioned already some of the risks of not getting enough sleep, and I'll close with just sharing some pretty alarming statistics that the CDC put out in 2020. It's estimated that 35% of adults in America had insufficient sleep. And I think if you just looked at the women population, it's probably higher.
I bet.
I really do. Any other thoughts or questions that you have about sleep?
No, I think this is really such an important topic. It's huge. And I think, women should just be aware if they notice any of these things to talk to their providers about them, and that there is, again, there's help, that there's things to try and changes that you can make to see what might help you. Yeah,
we all deserve a better night's sleep. And sleep is not weakness. Sleep is not laziness. It's your body asking for repair, for regulation, and restoration. And if you're a woman waking up every night at 3 a.m., you're not crazy, but you do deserve answers. So we hope you will share this with a friend. We hope you'll talk to your healthcare provider. We hope you get that sleep study if you need it. We're here for questions. We hope you get answers. And thanks for joining us on a journey to a whole woman health.
Thank you for joining us on a journey to whole woman health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. The information shared in this podcast is for educational purposes only and is not intended as medical or mental health advice. Listening to this podcast does not establish a doctor-patient or therapist-client relationship. Always consult your own qualified healthcare provider regarding any medical concerns.